Hello, everyone, and thank you for joining us on this week's Have You Heard? Armor Animal Health video series. This week, we're going to be talking about calf health and how you can evaluate your calves. My name is Katie Halowinski, and I've worked with Armor Animal Health for the last 11 years. Before that, I grew up around the corner from my grandparents' dairy farm, which is in northeast Wisconsin, around 30 miles south of Green Bay. That's where I became very active in 4-H and FFA and went on to attend UW-Madison and then started working at Armor Animal Health. So it's been a very tough summer for cattle. And with all the heat that we've had so far, I think now we're finally catching a break with some cooler temperatures, but we will likely have some hotter weather to come before the cooler temperatures are here to stay. And a particular animal that is getting impacted negatively are our calves. With all these high temperatures and humidity that they have been experiencing, they're getting hit hard. So we hope that wherever you're joining us from, wherever you're viewing this video from today, that the weather is nice where you are. Let us know where you are viewing from. Let us know also what the weather is like by you. And I'm just going to glance over to see where we have some people joining. It looks like we have someone from Janesville, Wisconsin. Welcome. We're glad you're here. And we also have someone from Almond and Waterloo. Awesome. Well, keep commenting whenever you join. We'd love to see where everyone is joining from today. So we know your time is valuable and we want to go ahead and get started on today's topic. So today we have one of our professional services veterinarians, Dr. Larry Judge, joining us. Dr. Larry has been with Armor since 2012. He received his DVM from Michigan State University in 1987 and PhD also from Michigan State in 2001. He also became a board certified dairy specialist in 2010. So Dr. Larry, we are so excited to have you here today. Why don't you tell our viewers a little bit more about yourself?
Yeah, thanks, Katie. Well, I live here in Michigan, and I grew up on a dairy farm in the state. The dairy farm was started by my grandfather, and it's now owned and operated by my youngest brother and my cousin. They currently milk 430 cows and farm about 1,200 acres. I live an hour south of the family farm where I grew up, and that's in the town of Lansing, which true Michigander have to, show where you live. I guess other hand. So it's right in the center of the Lower Peninsula. So Lansing, East Lansing are kind of hooked together, and that's where Michigan State University is. Lansing's the capital of Michigan. I live with my wife, Jolynn, and 3 cats. We each have 2 children, Joe and I do. She has 2 boys, I have 2 girls. And now we have 2 grandchildren as well. So for Armor, I cover the Lower Peninsula of Michigan and also Ohio and Indiana.
Thank you, Larry. It's so funny how you point to your hand where you're from. I used to do that too. Wisconsin, we do that too. Northeast Wisconsin. This is where Green Bay is, right?
Yeah.
So
and in Michigan, we can also, do the Lower Peninsula and the UP too.
There you go. Both hands.
Yeah, both hands.
Nice. Well, before you begin today, Dr. Larry, I want to let our viewers know that throughout today's presentation, they can ask questions in our comment section and we'll be sure to get those answered. If you're watching the recorded version, still go ahead and ask questions and we will get those questions answered as well. So, Dr. Judge, let's get started. What calf issues have you been seeing recently? And how do you feel that the weather with these hot summer months has influenced our calf health this summer so far?
So far this summer, I've observed a lot more calf health issues than we typically would see in a typical summer. Usually in the middle of the summer, we see a decline in calf foot diseases once we get to warm, dry weather. It's not too stressful on the calves. But I think the heat stress this summer has really played a significant role in causing calf health issues and has increased the risk of disease for calves. Calves begin to experience heat stress at about 85 degrees, which is maybe about where we do. And we've certainly had many days in a row above this level recently. So just recently, I've had many older 3 to 4 month old calves that have contracted severe salmonella pneumonia. And normally we wouldn't see this issue in the middle of the summer or really any other time of year for that matter in calves this old. But I think the severe heat stress has decreased their level of immunity to the point where this disease has happened this summer.
Yeah, that's very interesting, but not so good information, right, Dr. Leary? So when it comes to calf health, how do you determine if a calf's health is compromised? And then once you have found the problem, how do you tell if it's just that particular calf or if it's the entire group of calves?
So calves with a severe systemic infection like salmonella, they obviously appear sick to anybody. They're oftentimes laying down, breathing very hard, lay stretched out. They just look terrible. But the real challenge is a calf that has just begun to be infected with disease. They may not act very bad. They may be only showing subtle signs of disease at that point. So just a little aside, the word disease actually has 2 parts: dis, meaning lack of ease, and or dis meaning not well, and lack of ease meaning feeling not well. So the word dis-ease is just 2 parts. Lack of feeling well is all it means. So early in the disease course, the best time is the time to detect disease, as early intervention in calf foot diseases greatly increases the probability of a successful treatment and good outcome for the calf. If we don't treat calves early in the process, oftentimes the outcome is poor. So young calves are really like any other infant mammal in that they mainly do 2 things: they eat and sleep. So those of you with young children kind of know how that is. Nursing calves seem to know when it's time to eat, much as your cat or dog might know when it's time to eat, and they'll act hungry and want to come to the front of their pen and vocalize when they know it's the time to eat. So they're very good at associating noises with feeding time and impending feed delivery. Like on my family farm, the sound of my uncle's John Deere Gator approaching with the milk. They get very excited as soon as they hear that engine. We can certainly use that as an indicator of calf health, because any calf that's not at the front of their pen and ready to eat may not be feeling that well. In older weaned calves that aren't on milk anymore, but maybe still are in their individual pens or hutches, we can use grain and starter intake, water intake to indicate their health status. Like any other animal, if they're not eating, they're not well. These calves, for these weaned calves, and maybe those still on milk too, when they stand up from a laying down position, if you're watching them, they should stretch, kind of like they're just arching their back. If they don't do that, they are maybe not feeling just right. I learned this from my uncle that still feeds calves on our family farm at the age of 75. He always watches for calves to stretch when they get up. And finally, make sure that they have good, clean feed and clean water, especially in front of them at all times, especially in this hot summer weather. And always ask yourself with the water or the feed, if, especially the water, if it's not clean enough that you wouldn't drink it, well, you really shouldn't expect the calf to either.
Yeah, and it's amazing the things you can learn from your uncle, how he said to look for that stretched out calf. And thanks for also telling us some other things that producers can look for when they're detecting diseases. When they do find something, how do they know if it's normal or abnormal? What should they look for?
Well, as I just discussed, feeding activity is a good time to observe health status in calves. But in between feedings, you can also look for other things. You can observe the respiratory rate, the activity level of the calf, and that feed and water consumption I mentioned as signs of health or lack thereof. And when you actually are feeding the calves, you can get a lot of information by how they're eating. This pertains to calves still on milk. If they take frequent drinks or breaks between while they're drinking milk, that can mean they're not feeling just right. Certainly if they don't drink all their milk or seem interested in drinking milk in the first place, well, then they're obviously ill. but even slow drinking can mean that something's not quite right with that calf and is the beginning of a disease problem. At this point, you should dig deeper into the calf's health if they're showing subtle signs of disease, and do a physical examination on that calf. That should only take you a couple of minutes, and you need 2 pieces of equipment to do a physical exam on a calf properly.
Okay, Dr. Larry, so you mentioned you need 2 pieces of equipment. Go ahead and tell us what those 2 pieces are, how much they cost, and can you describe how to use them? When you're using them, what do you look for considered normal versus abnormal?
Okay, so all you really need is a cheap $3 thermometer, such as this digital one from Meyer. These are a little harder to find and a little more expensive now than $3. I think they might be 6 or 7 now, and that's because of COVID and everybody buying these up. But you can still find them. And then the only other thing you need is a stethoscope. This is a cheap $5 model, which is kind of my favorite stethoscope for calves. It has a very long tube on it, so you can reach down to that calf. And that's really all you need. So first, start out by taking the rectal temperature. Should be about 102. Anything over 103 would be classified as a fever. It means the calf probably has a bacterial infection going on somewhere. That could be a gastrointestinal tract or respiratory system infection, or it could be a navel infection. Next thing you want to do is listen to the calf's lungs. And this can take a little practice, and your herd vet or armor vet can show you how to do it. What you're really listening for is the presence of expiratory sounds, which is when the calf breathes out or expires. Any noise that you hear on expiration can signal that there's some inflammation going on in the lungs. You normally should hear inspiratory sounds or air moving in, but then when the calf breathes out, should be very quiet to almost to no sound. So just like anything else, it takes a little practice to get kind of used to what's normal. I would recommend listening to some normal calves, then you will know what abnormal is. And then also, while you're doing that, you can just reach under the calf's belly and feel the navel cord or belly button. It should be very small and dry on the end, and the calf shouldn't be very sensitive about you touching it. Navel normally takes a few days to dry up and shrink after birth, but with experience, you'll kind of know what feels normal and versus what's a problem. It's important to distinguish between a swollen navel, an infection, and differentiate that from an umbilical hernia, which is where some of the intestines might be sliding through a little hole in the body wall, which isn't really a big problem unless it's really large. It just takes a little practice to distinguish those. Again, your armor or herd vet can help you with that too. And then last, always just be sure to assess the hydration status of the calf. The best way to do this is with what's called a skin test. You just simply pull the loose skin from the side of the neck out and let it go. Normally, it should snap back very quickly. Any slowness indicates dehydration. Also, the eyes of the calf will indicate hydration status, because if they're sunk in very far, that can help too. There's some good guidance on the web for how to assess hydration status in the calves as well. Finally, always, before you approach the calf, even observe them for coughing or diarrhea. And you maybe by this point kind of have already seen the calf maybe cough or have some loose manure. And that's a sign of where the problem is too.
Got it. So basically, listen for the lungs, do that hydration test with the skin, and also looking at the navel. Those are really good tips. And also, observing the cough too to get started. So thank you, Dr. Larry, for walking us through those. So once you're done with that physical exam and you notice something that could be off, what needs to be done and how soon does it need to be done?
So with calves, always the sooner you can treat in the disease process, the better your outcome. And fortunately, now you've done that physical exam and observed the calf, you probably know what the calf's problem is. And calves are basically very simple creatures in that they only get really 3 diseases very commonly: scours or diarrhea, number 1, number 2, pneumonia or respiratory disease, and number 3, navel infection. So I don't really have time today to go into really a lot of detail on appropriate treatment, and that's going to, of course, vary by the farm and the veterinarian as well. But there are some general principles that we can discuss briefly that apply to these diseases. Certainly for scours, the most important part of treatment is the correcting dehydration, which is likely present because they're losing a lot of fluid in the loose stool. For minor dehydration, oral fluid with an electrolyte added is usually adequate, but if it's more severely dehydrated, maybe you didn't catch the calf quite quick enough, some sub-Q or some intravenous fluids might be needed. Banamine can help calves feel better with scours and reduce the fever if they have any, and also reduce the diarrhea. There's other products you can put in orally milk or in the milk to help reduce fluid loss too. And antibiotics are only needed in scouring calves if they're very ill. And that's best evidence if they're by whether they're not eating or not. If they're not they're not scouring and not eating, that means they're a little sicker and antibiotics might be indicated. For respiratory disease, certainly antibiotics are almost always indicated. And Banamine also can be helpful to reduce fevers and make the calf feel better. And naval infections usually respond really well to just a few days of antibiotic therapy. So again, I always emphasize treating early in the disease process greatly increases your chance of success. This is a primary reason why I always recommend just one person on the farm should be in charge of calves, because when multiple people feed calves and care for them, no one person maybe is ever knows when a particular calf started showing signs of disease. Some of the biggest calf raising disasters that I've seen, I've observed when many people were feeding calves, but no one was actually in charge. Therefore, nobody actually treated sick calves until it was pretty late in the disease process.
That's a really good tip, having that one-point person, or make sure that one-point person is writing down everything that was treated. That's really a good tip. Thank you, Larry. So now that you told us how to detect and treat calf diseases, let's take it back a step. How do you prevent these diseases in the first place? So what should calf raisers do to keep their calves healthy and disease-free?
Well, yes, prevention is always the best for any animal, and in particular calves. Most important thing to keep calf healthy is to feed them good quality milk or a whole milk replacer or whole milk, and feed it in adequate amounts. So this means for me at least a pound of replacer in 2 to 3 quarts of water twice a day, or 3 quarts of whole milk at least twice a day. Some farms feed 3 times, or even feed a gallon, or feed up to 3 times a day. So, but these are kind of minimums for me. In cold weather, I like a third midday feeding of milk replacer or milk, as that helps keep calves healthy and growing well when their energy demands are high to make heat in the cold weather. Next, we should always offer, and the farm program says now this needs to be at 4 days of age, offer a good quality texturized calf starter that's at least 18% protein. I'm seeing some at 20 now, which is even better. The immune system of the calf works best when it has a lot of energy to work with. So the more milk replacer or whole milk, and the quicker the calf eats starter, the more energy the immune system has to function and fight off disease. And finally, calves should always be offered fresh water. As I said, the farm program now says that should begin at 4 days of age. We're up to version 4.0 now of the farm program. And I think I see a lot of farms that still don't offer enough fresh water to young calves. And that really reduces their starter intake dramatically. I always say the sooner calves consume more starter, the healthier they are and the more growthy they will be. An analogy I give people is to say, if you're the calf trying to eat calf starter without water is the same as we are trying to eat some salted peanuts without something to drink. You just can't eat very many before you have to stop, because you don't have anything to drink to get that salt out of your mouth and wash it down. So quite often I will observe calves that are out of water, and if I fill their water bucket, they'll immediately start eating some starter after taking a drink. So, and that's going to really help the calf's health both immune function, and also it's going to help the calf grow better too.
Yeah, and that's some great information and good analogy too with our peanuts and water for humans too. So I want to remind everyone, take a break here and remind everyone that please ask questions throughout. Dr. Larry has provided some really great information, and if you have to pause the video and go back later or even watch this video again on our YouTube channel, you can do that. Another question I have, Dr. Larry, is what are some of the other factors that can help prevent calf foot disease and help keep our calves healthy?
Well, second only to what I discussed as, good feeding and watering. And this is no secret, but and so everybody knows this already too, is that we just need to keep everything extremely clean around those newborn calves. Remember, calves are infants, and as such, kind of like human babies, we have to keep everything very clean. They can't fight off disease-causing viruses and bacteria very well at this young age because their immune systems just aren't very well developed. So the less exposure we can give them to disease-causing pathogens, the less chance that they're going to get sick. As I said, every calf raiser knows this and does their best to keep things clean, but sometimes what looks clean isn't really all that clean. Take your finger and kind of feel on the inside of your calf bottles or your calf feed buckets, and if you feel that kind of slimy, there's a slime layer in there, that's called biofilm, and that's where bacteria and viruses live, is in that slime layer. And if you can feel that, then you know that they're not quite clean enough. But sometimes even you may not feel that, and the surface may look and feel, clean, but there's still a lot of bacteria there. So there's a tool we can use called an ATP meter. I've got one right here, and we have a couple of these now at Armor, and these will help us determine if your equipment is really clean or not. You probably don't want to buy one of these because they look like $1,500, but that's what they cost. They're very expensive, but we do have a couple, and so if you would want your equipment tested, we can do that. All it takes is one of these swabs, and you swab a 4x4 area once it comes out of this little plastic sheath here, and whether that's a bucket or a bottle or your esophageal feeder, put it in the unit, and pretty instantaneously, in a few seconds, it gives you a reading. What it's measuring is ATP, which is adenosine triphosphate, which is basically the common energy currency, the fuel, if you will, of all living cells, whether they're bacteria or human or calf. And so where there's more ATP, there's more bacteria. Next, especially in cold weather, a good amount of dry bedding really makes a big difference to the calf. In the winter, that needs to be straw, I feel, to give good nesting and insulation to the calf. And this reduces the calf's heat loss and helps them conserves energy, which then isn't needed for making heat. It can be used for powering the calf's immune system. And of course, by now, everyone understands the importance of colostrum and getting that calf a good start early in life. Of all the factors we know now that influence calf health, this is probably the most important one. And your Armor vet or sales rep or your herd vet can help determine if your colostrum program is good. We can do testing. What you need for testing for colostrum is what's called a refractometer. They come in digital or they come in look-through ones. This is a look-through one I have. This actually is only for doing total proteins, but they also can be purchased that will do brick scale, and that will help determine if your colostrum is good. And having your own refractometer doesn't cost a lot. The look-through ones are about $100, and some for just bricks are even cheaper than that. The ones that can do total proteins are a little more expensive. The very nicest ones are digital in that it takes the variability out of it, so it just prints out or shows a number on a screen. The two things for testing colostrum are to test your colostrum for that brick scale. We know 22 and up is good colostrum. And then we can take blood from our calves and test for serum. That only takes a couple pieces of equipment. a vacutainer, or I prefer a 3cc syringe with a 20 gauge inch needle and just a small 3cc red top vial. And you can have your herd vet do this, or you can be trained to do this yourself. A lot of calf raisers do it themselves. And that really tells you where the rubber is meeting the road and if your colostrum program is working or not.
Great. Well, thank you for walking us through the refractometers, Larry. And just so everyone knows, if you do purchase one of the Brix refractometers, the digital refractometers from Armor, we do have a technical bulletin that goes along with that, that explains step-by-step how to use it. So they're not hard to use at all. So I have one more question, Larry, for you before we get to our viewers' questions. And that is, what do I do if I'm a producer that is experiencing a large amount of disease? Who should I contact? What should I do?
So your herd vet or Armor vet can do several things to help correct problems that may exist and may be causing a problem in your calf operation right now. First thing is to review your current calf care procedures, your feeding, your treatment, your vaccine program, and that may reveal a problem right there. Again, I mentioned assessing your colostrum program is very important, and see how well that's working. Testing some of your colostrum or getting a program set up for you to test your colostrum, and then either testing some calves, total proteins, or getting you trained how to do that yourself too, to see how if your calves are truly getting good antibody transfer. And if you have any recently dead calves, doing some necropsy and submitting some tissues and fecal sample to a laboratory for culture and determination of the causative organism can help identify the enemy, so to speak. It can help guide your vaccine program, treatment program, and kind of fine-tune your program to prevent that particular disease that is causing problems for you.
Thank you, Larry. And with that, we have a few questions to get through. Amanda is asking, are there more seasonal problems with calves when they're born in the spring or the fall? And is there a better time of year that is better for calves to be born?
Typically, we see, and this is mostly true of dairy calves on dairy farms that are being born year-round, is when we get to dry, warm, midsummer weather, we have less trouble. And when we get to drier but steady, cooler midwinter weather, we have less trouble. Calves can handle cold just fine as long as it's not severe cold, and as long as they get adequate nutrition. Real problem times of the year tend to be spring and fall for two reasons. One, a lot more moisture, spring rains or sometimes fall rains, early snows. Bacteria, viruses love moisture. So when there's more moisture in the environment, in the air, they tend to do better. Other big problem those times of year is greatly fluctuating temperatures. Midwinter, we have steady cold weather. Midsummer, steady warm weather. Spring and fall, we oftentimes have warmer days but cooler nights. And that variation in temperature is stressful to the calves, to all cattle or all animals. And that kind of hurts their immune function and lets the bacteria, viruses get a foothold sometimes.
Good answer. So another question we have coming in from Adriana is Banamine transdermal. Is that recommended for calves? And is it only for IV?
Well, the Banamine transdermal is meant to go on the skin. It's only for heifers 20 months and under. So I have had a few producers use it. It's a little easier to administer than injection, which now we're supposed to only inject IV. So it does make administration easier. It is a little more costly than the injectable. So, but I have had quite a few producers use it and like it quite well.
Got it. And another question, kind of similar. Amanda is asking, are there medicines that you recommend having on hand for when calves are born And when you take us through those medicines, also tell her if they are over the counter or if they require prescription through a veterinarian.
Well, of course, most everything that's any good requires a prescription these days. And so what one veterinarian might recommend is going to be different than another, and might be different for your farm too. For respiratory disease, there are a variety of products. Pretty much any that are any good are prescription now. Really nothing over the counter is very good in my opinion for respiratory disease in calves. So the newer macrolides tend to be my favorite, which are three: Draxxin, Zactran, or Zuprevo. Those are my three that I tend to use most of the time for respiratory. And then for nasal infections, I just use good old penicillin G mostly. And that is still over the counter at this point too. Probably in the not too distant future, there won't be any over the counter antibiotics anymore. Everything will be prescription because that's the way we're kind of moving. In the state of California, that everything that is antibiotic, all of those are prescription for cattle now in that state. And that's probably the way the U.S. as a whole will move in the not too distant future.
Sure. Yep, I can see that coming soon. So with that, Dr. Leary, it looks like we don't have any questions left. So do you have any closing remarks or final tips for us?
Sure. Oftentimes people comment to me these days, they'll say, well, these calves aren't as easy to raise as they used to be. And I usually say, well, I agree with you. I think that's true. I think we've focused a lot, and especially this is in speaking with Holstein, which is what most people have in terms of dairy. And maybe the same could be said for beef calves too, in some breeds, is that we've not focused on calf vitality that much. Beef maybe a little bit more, but in dairy, we really haven't focused on that. We focused on other things like milk production and components, milk components, and stature, type, and more recently mastitis, daughter pregnancy rate, things like that, but never really on calf vitality. So I tend to agree with them. I think raising calves is maybe has gotten harder. It's not easy. There's more pathogens out there now too. So you know, sometimes when you get a disease on your farm, it just seems like raising calves is almost impossible sometimes. However, that's the bad side. The good side is that we have a lot more knowledge, tools, products available these days that we can use to keep calves from getting disease or treat them if they do. I always tell a calf raiser when I'm working on a problem with them that, you know, taking care of calves is a lot of fun if they're all healthy and eating well and you don't have to treat any sick ones. But when they're sick and dying, it can be a lot of hard work and not much fun at all. So I always say my job is to help make feeding calves fun again. So your herd vet or your armor vet, we can help put the fun back in calf care for you if you're not having fun currently. And there's a lot of things we can do to help improve calf health and calf growth rates even more, even if you are already doing well.
That's very true, Dr. Leary. You definitely put the fun back in calf care or anything you do. So we want to thank you for your time today. We really appreciate you taking this half hour out of your busy vet schedule to be with us.
Yep, so, thanks, Katie.
No problem. Yes. So if you learned anything today and you would like to share this with your friends, please do so. Share and like our Armor Facebook page, or share this video onto your timeline. Also, if you are looking to go back and listen to something very specific that Dr. Leary said that you didn't catch fully, whether that be the thermometer, the specific temperature of 102 to look for, you can definitely go back on our YouTube channel and listen to this again. So if you are on our YouTube channel, you can still ask questions. We'll get those answered as well. Lastly, we are putting a survey in the link below, in our comment section below. Please fill out that survey. Let us know if there's a specific topic that you would like one of our vets to discuss, and we'll definitely have someone talk about that in the upcoming Facebook Lives. So with that, next week, we have Dr. Vicki Lauer. She's going to be talking on how ventilation impacts the calf's health. So I'll be with Dr. Vicki next week, and we hope to see you next Thursday at 3 p.m. Central Time on Happy Herd. Have a great day, everyone.